Yes. Officially, hello everyone, dear colleagues. It's a great joy to have you all here. The country representatives of the northern region of the European Confederation of Music Therapy have organized this event for celebrating the European Music Therapy Day with the name Music and Health. I want to thank my teammates for all their work in preparation for this event. Likewise, thank you to all our speakers for their time and willingness to speak today. And of course, to everyone participating in this event with us. This event will be recorded and posted on the European Confederation Music Therapy social networks as soon as possible. Don't switch on your camera if you don't want to have your image on this recording. At first, each speaker will give their presentation, and then we'll have time for discussion between speakers and the event members. Our first speaker will be the music therapist, Dr. Ruud. Ruud is a professor emeritus at the University of Oslo and the Norwegian Academy of Music. I will now give the floor to the professor, Dr. Ruud, please.
Thank you. You can all hear me?
Yes.
Yes, fine. Yeah, I will speak about music and health, and before I got this invitation, thank you for the invitation. I got this a few weeks ago, and some of you might know that after I got this invitation, or just a week ago, we published a kind of report on the topic of music and health together with Lars Ole Bonde and Karette Stenseth. So I would like to refer to this report, and because this is available for all of you on the internet, it's free for everyone, and so I think I will stick to that kind of conception of music and health that we have tried to outline in this booklet. I just published on the chat here. I published the link to this booklet, so you can all have it. You can just copy it and you can get it free then. Yeah. I also have there's a model in this booklet. A model of it's called a comprehensive model of music and health, and I will try to show you the model, but I'm not so familiar with the Zoom, but I will try to get it on the screen for you all, but we'll try that later. But first of all, do you have 10 minutes? Is that, it's about that, Gustavo?
Yes, it's about 10 minutes, right?
Yeah. Just I wanted to say that for me, let's talk first about music therapy then, because sometimes music therapy is more than just a practice. When we speak about music therapy, we have to acknowledge that it's a practice and it's a profession, and it's also a research, it's a discipline, it's a scientific discipline. And as we know, very often music therapy is defined just as a practice, but during the last 20-30 years, it has developed, into a more, it's a multidisciplinary or transdisciplinary, cross-disciplinary discipline. So you can say that music therapy then is just more than a practice. It's a way of researching the relationship between music and health. So when we are speaking about music and health, we are speaking, I will speak more from a research point of view. Like, this is a field of research. I mean, it's many ways to conceptualize. I would think the concept of music and health. I try to say, we could say it's a study of the relation between music and health, and it encompasses all areas or practices with music therapy, as well as other efforts to influence health from other professions, as well as the everyday use of musicking to regulate one's health. So we have to see that music therapy then, since it kind of has developed for so many years, it has gone expanded. It's not just not a clinical kind of practice, it's a community practice. But we also have to acknowledge that there's a lot of going on in the society, in the everyday life of people. They use music as a help to regulate their health. And I think all this kind of, and there's a lot of health musicking, we call it, going on in choirs, in bands, and everywhere where people are kind of gathering to do music together. So if we want to study the whole field of this kind of this area, we have to consider taking into consideration all these areas of practice, just go beyond the traditional music therapy, but we also have to include other ways of doing music. So that's how I see this kind of in this field. It's not a form of music therapy. It's more a kind of umbrella field, we call it. It's a kind of umbrella field or a discipline we kind of use to kind of catch all the different aspects of health musicking. I just try to put on to share the screen with you, but I'm not sure if I can succeed this, but I'll try to do that. It's well, I'm not sure. I should have prepared this better, I think. No, it's just a moment. Yep.
Evan, can we help you? You have to have it open on your desk before sharing it.
Yeah, I just put it open now, so I think I lost you a bit. Yeah.
You can try again if you want.
Yeah, I just opened it, and then it's open, and then I try again. Share screen. Yeah, that's it. You can see it?
Yes,
You
yes.
can, yeah, okay. Fine. So if you see, this is a matrix which Lars Ole Bonde made first, and then he has also developed it, and Karete Stenseth and I also contributed to this model or matrix. And as you can see, we try to make a comprehensive overview of music and health. And what's kind of particular about this matrix is you can see there are four squares here, and they're all kind of pointing towards different directions. You can see it's pointing upwards to the individual level and downwards at the social level. We're talking about the mind on the, I think it's on the left side, or and the right side of the body. So if you look at the upper left quadrant, we consider all kind of music therapy practices or health musicking practices that concerns what we call the technology of self. That's how people regulate their health in everyday life. We also consider all the kind of different ways of doing music therapy, like humanistic existential approach, psychodynamic music therapy, cognitive behavioral music therapy. So there's just how you see all the areas of health musicking that kind of has to do with developing identity or self, or kind of more in the individualistic way. We also use the Bronfenbrenner model of 3 levels. We talk about musicking going on the micro level, on the meso level, and the macro level, which is just to catch all the kind of nuances of all these quadrants. So, for instance, when we speak about music therapy at the micro level, on this upper left quadrant, we talk about how music is used to promote identity, for instance, or it's used to regulate emotions. When we talk about the meso level, we have lots of instances of music therapists working with, for instance, with rock bands or with opera performances with cancer patients. We have people working in prisons. mental recovery and mental health and so on. And when we are on the macro level, we are talking about folk medicine or public health, how music can be used as a way of public health. I think this is the best example of to see how music therapy as a discipline has expanded into this broader area of music and health, because it's now kind of going into public health also, which is Lars Ole Bonde and Therese Theorel also edited a book about that, which was the first, I think, effort to take music therapy kind of further out of the clinic and out of the communities and into the public life in a way. So what we do is we do this kind of work on all these 4 quadrants, and I think you can better read about it, how music therapy is used in the medical music therapy and on the different levels, and how it is used in community music therapy on the meso and micro levels, and not least also how music and health is also affected by the larger society, the soundscapes, the noise problem in our society and so on. So I think all these areas kind of, you can see that music and health and is umbrella kind of field studying all these kind of aspects of music and health. Yeah, so that's how I see it. I think so. There's, of course, this is a huge area to cover, and there's a lot of details here which you can read about in our kind of overview. But yeah, so I can come back and answer questions if you are interested in that afterwards. But I think it's 10 minutes should be. Yep. Okay.
Thank you so much, Dr. Evernold, for your words. It was really inspiring. So for now, I would like to invite the dear colleague Sari Laitinen from Finland, music therapist and physiotherapist. So now the space is yours.
Okay, thank you for having me here in this session tonight. In Finland, we are going to be like late nowadays at this point. But I want to share some of my thoughts as well. And thank you, Ruud, for the speech you just made. If I go to my slides at the first place, I'm a music therapist working in a hospital setting, so I can tell you something about my work by those slides, and perhaps it clarifies what I'm thinking about this subject of today. Do you see my screen now?
Not yet. You need to start sharing screen first.
Yes.
Just go for the green folder and then press
Yes.
sharing again.
Oh.
Because you have the permission.
Yes. I see only Keynote, Firefox, I don't know. Perhaps here.
Just go on Zoom together with participants. You see a green folder called share screen.
Yeah.
Otherwise, yes, now it's working. That's perfect.
Is it here?
It's still just loading. Let's see. It's supposed to work.
Do you see it now?
Not yet. It says that you started the screen sharing, but we are not seeing at the moment. Oh, yes, now that's working. That's perfect.
Okay, thank you. So I come from Finland and I work in Espoo Hospital, but also I have participatory work in Helsinki University in music aging and rehabilitation team. And just to tell you that in the hospital we do basic rehabilitative healthcare for the elderly, and in this county there are like 500,000 inhabitants, and there are 3 hospitals, but only in Espoo hospital there is a music therapist. We have some cultural well-being engagements. We have a staff choir, we have an art path, and we have regular musician visits of Tapiola Sinfonietta. And what I think we do as to promote health with these cultural events is like musicking together, seeing somebody doing something and participating in these events. And we can also play with the musicians that come over us. And of course, as a music therapist, I do this in a purpose of getting them in better function and reduce anxiety when coming into hospital. And in this team, with the music aging and rehabilitation team, we have the data that singing can improve the verbal recovery of aphasic patients. Music listening can improve your mood, and active playing has input on the gray matter volume in the brain. And this all we know, so only one music therapist can't afford for everybody this meaningful source of getting well. So I think it's a great possibility to have artists to come over us and also play and sing with the patients. And I think it's not the matter of who sings, it matters that somebody sings with the persons with dementia as well. And dancing is for everybody, and we can sometimes have arrangements that those who were in the hospital earlier come over and introduce their new hobbies to the patients that are inside the hospital now. Here, for example, this Still Alive dancing group is one of those groups that were former patients, but now they are actually doing dancing, and they came over to us and invited the patients with them to dance. And perhaps you have read already this Love in a Cold Climate, Creative Aging in Finland. There are many cases. How do we do artwork in different places, like not only hospitals, but also in other healthcare and social places. Taru Koivisto has made this dissertation on the unsettled space of healthcare of musicians, and she has found that healthcare musicians' work can support the emerging well-being discourse. And of course, you can have education on the matter. In Turku, University of Applied Sciences has made training courses for the artists to work in social and healthcare business, but also for the professional healthcare people to use arts in these places. So I should suggest that this could also be one book to read and have ideas what it means to use art in these settings. But still, I think that music therapists, we have unique skills, and they are, of course, we are sensitive, affective, reflective, and intuitive. And I think this is something we have to have when we do processed work as a music therapists. It's not just one time shot, but we do processes and help the patients to achieve their goals. And on behalf of Music Aging and Rehabilitation team, I introduce to you this Neurosciences and Music conference that will be held in Helsinki next June. So welcome. And this was my presentation.
Thank you so much for your presentation. It was really inspiring to hear you. And now, so we have our last speaker for today. So we have Eleanor Donnebaum from UK, and she's a community musician.
Yes, hello. Can everybody hear me okay?
Yes.
Good, good. Brilliant. Hello from England and hello to everybody. It's really lovely to be here. Thank you for having me. It was really great to hear the other speakers and to hear their views on things and their perspective. I can only totally agree with what you've said, and like I admire your work, and I think yeah, it's very inspiring. So thank you for sharing. Yes, so I don't have a slideshow, so you will just have to do with my face and looking at me while I tell you basically a story. That's what I've planned. I've planned to share with you what a community musician is and how the organization I work for, Chiltern Music Therapy in England, has grown from 5 music therapists to now a team of over 60 music therapists, community musicians, music producers, etc., etc. So basically, I'm really lucky to have been one of the first community musicians to start working for Chiltern Music Therapy. I think 8 years ago now. Yes, basically to use those skills a community musician brings, a musician brings, with a different background to a music therapist or an NMT, a neurological music therapist, to basically collaborate, combine the different kind of skills we have, the different knowledge, the different way of approaching groups, sessions, individuals, anything really. So just to give you a quick kind of overview of where I come from, I was actually born in Germany, so I'm half British, half German, and I studied in Germany. So I'm a trained social worker, a trained social pedagogy, you would say, in Germany, with lots of elements of psychology, also elements of drama therapy and music therapy. So music always played a huge part in my life, and maybe some of you listeners as well can relate to that music might have been part in your life, and maybe you're actually thinking, how can I use music in my work that I'm doing, or how can I bring music to grow something and build on something, even though I'm not a music therapist. So here we go. I have basically then chosen to work in many different settings when I finished my studies. So I started working in loads and loads of different settings, working with people with dementia, people who've had strokes, people with epilepsy, children, adults with learning disabilities, severe learning disabilities, etc., etc. The list goes on. People with autism, etc. And I have always used music as a tool to communicate, to spend time with the people, also to combine my knowledge and my musical skills with other health professionals. So in my work, the past, gosh, how old am I? The past maybe 15, 16 years, I've actually worked quite closely with physiotherapists, occupational therapists, speech and language therapists, other social workers, other music therapists, and combined that kind of musical insight with the other health professionals. And I think that is something that our organization is trying to maybe progress on and open up a bit more and raise awareness that this is a really great way of benefiting and using music for many different people to make it accessible for many people. So again, music and health is not just music therapy, like both of the other speakers have shared. It's a real big combination of different areas, like we've seen in that beautiful slide earlier. And again, I guess the good thing with the kind of approach that I bring for the organization is that I'm quite flexible, and also I can be quite diverse in my approach. Whereas maybe a music therapist and an NMT, how amazing they are, because they are, specific interventions needs to have a music therapist or an NMT say for instance, you know, in a hospital setting as well, when you are working specifically maybe in NICU and the neonatal intensive care unit, again, that can be looked at. What suggestion could be made that maybe a person comes to sing, that could be someone from, you know, a musician who can sing, who could come and sing to the little babies. But if there's a specific goal, a specific intervention, I would obviously totally agree that needs to be a music therapist with that knowledge, with that training, with that specific knowledge and expertise. So we kind of work with that kind of circle of care. So that is like a nice visual thing. So if you think about maybe getting a referral in, we would get a referral in maybe from a family saying, okay, my dad has early onset of dementia. He would really benefit from being in a group singing, you know. Could then use a community musician like me to run those sessions, to have a group of people maybe with dementia or other age-related illnesses, and have that kind of social, you know, that well-being, etc., that the familiar songs for that person. But if I would realize that there's like some it's getting worse and it's like regressing, maybe then we could say, you know, right, I think a music therapist or an NMT might need to now come and like do a one-on-one and work with him. So we would go back into our system basically. So the circle would go round. And then there might be at the end of life, might be another music therapist that will be used. So that's one way of looking at the circle of life. It's also it can also work the other way, circle of care, sorry, which would basically mean that, say, there's a stroke patient who needs an NMT and a physiotherapist together, maybe combined. NMT, sorry, neurological music therapist. So we have, our organization has music therapists that are trained, and we have neurological music therapists that are basically as an extra training, where it's like really scientifically proven, and a lot of research has been done to really show that music therapy is something that, you know, is really beneficial for cognitive, behavioral, and memory, every single part, communication, every single part of recovery, or, you know, that we are experiencing in life. So yeah, did that answer your question? Anyway, sorry, I can maybe talk more about that in a minute, but yes, so we would then, for instance, with a stroke patient who may need more support with speech, movement, etc., we would probably suggest an assessment with a neurological music therapist. There we go, thank you. We would probably use a neurological music therapist to start off with a stroke patient, and then maybe realize, brilliant, you know, it's what the goal has kind of been met. We now would like to offer some, you know, some social, some other, you know, some groups where other stroke patients are, or stroke survivors are, and this can be run by a community musician who is obviously experienced in that field. And I think that's the most important thing, and the challenge as well, is that to make this work and to kind of combine all these different skills and expertise, is to make sure that a community musician working for a music therapy organization has got the experience, or the knowledge and the training, the right training, to be able to hold these spaces, to be able to work with people with dementia, people who've had strokes, etc., which I personally have had that experience. So that's really very helpful, of course, because then I can be used in many areas because of the experience I've had in different settings. I'm not sure how much time I've got. Maybe I need to stop talking, but I just wanted to finish really to say that what I also find really useful that is happening in England is social prescribing. So basically your GPs, which are your general practitioners, your doctors, if you're, you know, if you're unwell, you can be prescribed some music sessions. So that's something that is really starting now. Whereas, say for instance, an isolated elderly man or woman, you know, may feel really, really down and low, may go to their doctor and say, I'm not feeling great. Is there, you know, anything I can do? And they might then say, oh, you know, all of this list of, there's a community music group run by someone who's experienced in, you know, in that area. There is Let's Sing, there's, and all of these different community groups that are kind of coming up everywhere, and I'm sure in your countries as well. And then people can benefit from using those spaces. So that is something that is really incredible. And yes, exactly. There's loads and loads of different groups, exactly, subgroups for social prescribing as well. Loads and loads of different people that are offering amazing workshops and amazing groups. Yes, so for my own personal experience, I've never actually experienced any negative or competition with other health professionals. I've always worked really happily and closely with other health professionals, and of course with the music therapist. And I love that we are kind of mixing our offerings and different approaches and different ways of, you know, of doing music. So yeah, that's my kind of thought and my part in music and health. So thank you so much for listening to me rambling on. I'm quite passionate about this area. So yes, thank you so much for having me.
Thank you so much, Eleanor, for your inspiring words. So for now, I think it's the moment that could be so important for us, the moment for discussion. So I'm happy that we have about 25 minutes for discussion. So feel free for anyone to just open your mic and raise a question. And of course, our speakers will be so happy to discuss about your question. So just open your mic and speak up, please.
Yeah, I can just comment. Katarina here from Sweden. I was part of planning this, and I just love. Thank you, Eleanor, for your way of speaking about it as a both and, not either or, and that you know, even if there are specific situations where music therapists will be needed, but only counting numbers, we won't be enough. If we want to have a monopoly of making it all by ourselves, we won't be enough people. So to welcoming and cooperating with musicians and other peoples in the field, that's just great. I like that. Thank you. And I also saw in the chat, Lars-Ole is going to make a review now or an overview. Yes, please, Lars-Ole, do that. I'm looking forward to it.
Brilliant. Oh, thanks for that. Thank you.
I have a question to, can you hear me?
Yes, perfect.
Yeah, it's Brynjulf from Norway. I have a question to Even, who has written this publication together with Karette and Lars-Ole, which actually goes to everybody, actually, because you have all been talking about how we need to expand boundaries and how we need to collaborate. And I would like to hear some reflections on what kind of implications that would have for how we train our music therapy students in the future. What kind of competencies do they need in order to work in this much broader landscape?
I have to unmute. Yeah, that's a big question, of course, but I think we can see as music therapy has developed over the last 50 years, you can see that they have become more specialized, and at the same time, some of the works we have been doing is also taken over and supplemented or supplemented by other musicians, community musicians. That's what you just heard. So I think there are some questions about jurisdiction here. If you want to cooperate or you want to fight, or I mean, there are different traditions within every country, as we know, and And the training in Norway is quite broad, I think, because we have the community music and we have the clinical tradition and so on. We have a strong theoretical tradition. So I think we have to just acknowledge that we have to cooperate with other people because there are too few of us doing health musicking work. But at the same time, we need to go further in the specialization. We need to specialist music therapists. We have to develop new programs beyond the master degree for specialization. So we can kind of keep up the professional standard, I think. So what we can teach the students is just to respect other health musicians and put more emphasis on cooperation, perhaps, and also train music therapists to be supervisors or mentors. And yeah, that's one way to develop the profession of music therapy. Yeah, that's a short. I think we agree, Brynjulf.
Yes, we probably do, and I would really stress the latter dimension, that really to train students in working at a systems level, to collaborate, to supervise, to support a range of practices, and that's a different kind of skill set than doing therapy in the music therapy room. So, and which I can see that it's not something which students learn automatically. It's something we need to focus upon in the education programs and to really work with how to develop that kind of understanding of society and that kind of skill set that you would need in order to work in that way.
Maybe I can say something here. I think it's very much about further education, and it's about making networks. I can give you an example of this. Last week, I taught at a course or a meeting of a network of hospice therapists in Denmark. And this group includes both music therapists and community musicians and other musicians. So it's very nice that we can bring our competences together and discuss what is really necessary here and now within these institutions that we're working with. So there are many ways of working with this. In the education, I'm not sure that we need to teach anything but humility. We need to be very humble about what we're doing as clinicians, and we need to be very much aware of who we are working with, both other staff members and the patients and their relatives, of course. But the students will learn when they come into practice.
I almost agree. I think to be humble is a good starting point, but I mean the ecological model of Bronfenbrenner also have a few other dimensions than what you talked about. In addition to the micro, meso, and macro, it's also the exo system level, how we work with local authorities in order to create the necessary conditions for this kind of work, and also the chrono dimension, how you work with these things over time. I'm not sure I agree that to be humble is good enough. I really think you need to have a understanding of, for instance, hospitals as extremely complex systems, and cities and municipalities are often also very complex systems. And I don't think every student have that kind of understanding of the complexity and the natures of those systems and how to work within those systems. So my appraisal is that perhaps we need to change our education a little bit and to stress this kind of work at the systems levels to a higher degree than what we have been doing.
I would add, so I'm Canadian and trained in Canada, but work in England as a music therapist and a music teacher in a school. And my training did not prepare me in terms of how to be the music therapist that I am now at the school, which is very much inspired by frameworks of community music therapy, but that was through wading through myself for many years and finding that way, and was never kind of taught those broader skills. The mainstream school is a very complex, chaotic place, but also to the fact that, you know, going back to what Brynja said about being in training, and, you know, so much of the literature says that teachers teach and therapists help, and they just make this simple divide. And I think, as most of us know, that music teachers do so much more than teach. And music, if you teach someone a skill, does so much more inherently than just giving them that skill. So on top of rethinking or reflecting on how our training is done for people engaging in music and health practices, how we can start to shift the discourse that for so long has, as Evan said at the start, boxed up, you know, talk about practice versus discipline versus profession, because at conferences and things, it still feels like we are continuously trying to find the boundaries, even though there's so much more wonderful gray areas happening in terms of overlapping and our expansion of our practices. It still feels like we have this contradictory of boundaring our professional identities. So I just wanted to add that and see if anyone had anything to say in response. But thank you to the speakers.
Carita just wrote here in the chat, and she's totally right. So if you prefer just to organize better the system for comments, reflections, and questions, you can use in the reactions, you have the possibility to raise your hand if you prefer to do your question or just to carry out your reflections. Okay, but of course, if it's not working for some of you, of course, you can just open your mic and speak up.
It was me. I was trying to raise my hand and then I couldn't. But can you hear me now?
Yes, that's perfect.
So what we're talking about here is not just about education, and it's not just about differing music therapy from everything else, and it's not about everyone else types of musicians defining music therapy and where music therapists are how they are defined. And I also think that there's so much going on in the big music and health field here, and there's so much different going on in different countries and also within the different education systems. And Brynjulf is right about the level above, the macro level is even an existential level above there again. And Eleanor slipped her tongue a little bit when she said circle of life. Instead of circle of care.
Yeah.
And that was a good tongue slip, I think, because I think in the big circle of life, we're all involved in music, and there's a lot of people who can be involved in music and health musicking types of activities, but the intentional work with music for the benefit of a defined health goal, I think music therapy is a specialized field, and it will expand. It's still expanding. It's still it's already involving community levels. I think it's a lot of that happening in the research, especially. And now it's the time that, especially I think in Norway, that it's so filled up with stuff. And we're talking about specialization. I don't know if you are doing that in the other countries, but we're talking about, like, in psychology, you do a general education in 5 years training, and then you go into a specialized area. So dementia could be one, and children in vulnerable situations could be another, and so on. So this is already expanding into different types of populations, but I think it also can expand in terms of working, in my imagination, developing the music therapy within the more public health area, and where there is more integrated with a lot of other professionals. So I don't know what's going to happen in the future, but the field is big and is already expanding. But it's very important that the music therapy is still professionalized and being developed, and to secure the professionalism in everything that's being done. Just like you wouldn't put it's important for people to talk together and to have good conversations. You don't have to be a psychologist to do that, but some other trainings would be better fitted for people to lead a good conversation, I guess. But you wouldn't put anybody to work with a traumatized child, for example, and to work with health goals. So I'm talking my way off the topic, but I think the field and what we were talking about, even the draft of the model, it's not about dichotomies and the arrows going in different directions. It's just drawing some of the topics that are already in it. And it's also pointing to activities and practices where music therapists are present and where they're not present.
Mm-hmm.
And this is important also for music therapy to define when and where and what is not music therapy and is music therapy.
Yeah.
I was talking to everybody. I wasn't just talking to Eleanor, I guess. A lot of things I said there. I'm sorry.
Thanks a lot, Kari.
Sorry, I was just like agreeing. I didn't actually realize I wasn't on mute, so I'm sorry about that. I was just agreeing with what you were saying.
I just want to comment that it's interesting to discuss this topic, and also at the same time to reflect about training, because even though we are organizing this event from the northern region of Europe, even inside of Europe, we know that the things are completely different considering the different countries when we talk about music and health. I'm just highlighting, not saying that it's completely different, but it's important also to consider our local differences about this topic. And also, I think for me, it's important to say we are not approaching the end. We still have 10 minutes. But one thing that's really important for me to say, that when we finish this meeting, the plan is to post on Facebook, and the discussion will continue there, because our plan is not to stop here. Our plan is after, with the video that will be posted on Facebook and also on YouTube, but especially in the European Music Therapy Confederation Facebook, the plans that we can continue this discussion that we are having here in Facebook, because it's important not to finish what we are talking during this hour. It's important also to digest everything that we are hearing and we're reflecting now, and also having the time and then to write something about what you're thinking, and also to raise other questions. This is important to highlight. But still, if you have other comments and questions, please speak up.
I guess I just wanted to quickly maybe just add, just say that there obviously is a huge difference between a music therapist, a trained music therapist, and a community musician. Of course there is. I think it's very much about looking at those boundaries. Which area is accessible, and where are musicians or community musicians or other health professionals able to hold that space and support these people in a obviously in a good way, in a trained way as well, with experience and knowledge, and where are the boundaries, where are the areas where it's definitely not acceptable or okay to maybe have a community musician hold that space. So I think that just needs to be made very clear. I think another thing is that why we're so passionate about this kind of collaboration is because it is more accessible to some people. The financial aspect of things as well. Music therapy isn't cheap in some countries or in some places, I don't know, I can't speak for the whole, you know, of your hometowns and home countries, but it isn't always as accessible for everybody, which means, yes, of course there's funding, but sometimes it's really great to have just a group which is, you know, run by someone who has that experience and that knowledge, and it's accessible for the community to come and be there, for instance, and the cost isn't as high, which means, again, we're raising awareness, we're bringing that music and that health to these people, and it's not not cheap for music therapists, because they are trained, and of course they need to, they have that profession, and a musician may be happier to say, of course, I'm not going to be asking for this and this much amount of money to run this. Do you know what I mean? So I think that's also really interesting and important aspect to look at, that that it's accessible for a wide range of people then as well. So that was just one thing, but of course to make the differences clear and the boundaries clear. Yeah, that's just what I want to add that.
Eleanor, can I ask you, when you talk about your training, have you had specific training as a community musician, or do you have your musician training that was one thing, and then you mentioned you trained as a social pedagogue and you have done some psychology courses, but have you had any specific training as a community musician, or is it that you've got a kind of a jigsaw of all the different bits and pieces that you apply to when you're working?
Good question. I think this is something that we're definitely looking at our organization, that we would like to offer proper training for community musicians specifically. I guess for me it was luck, but also that bit of a jigsaw piece, that with my past and my experience in music, I went to a music specialized school in Germany, and music always played a huge part in my life, and I always used music. And then of course the kind of social work side of things and the psychology side of things, of course, helped for me to find these different settings where I could then work with people and use that music in combination. When I started for children music therapy, we definitely had some training. So training was given in terms of we were in shadowing the music therapist. We were with music therapist and basically talking about different scenarios, talking about different groups, talking about individuals. What are we capable of doing? What are we, so they would definitely give us their knowledge and background and expertise. So we attended quite a few workshops, and watching music therapists do some work as well. So there was a lot of that where you basically learnt shadowing a music therapist as well. And of course I've had that experience running music groups already, so that helps. So I guess if you've got that experience and that knowledge running music groups, even if it's at a school, even if it's just a community choir, at least you've got that experience in running a group, knowing what it may mean, if that makes sense. But there are definitely some trainings out there that you could probably do, but it's not run by the music therapy organization or anything. I think it's just you have to find them online. So there are definitely community music courses out there, and music and health courses and stuff like that. Yeah.
Thank you.
I just have one question here in the chat from Olga Ivanova to Eleanor. How community musician groups are organized? How can participate? It's covered from health insurance, or participants pay themselves? I'm Olga from Latvia. We don't have community musicians groups. We only start music therapy practices in hospitals and home cares.
Wow. Okay. Hello, Olga. Thank you for the question. So yes, again, this is something that my organization in England just started to organize about 8 years ago, realizing that there is a need for these community groups, that there is a need for people to access different, music for health, music for well-being, especially, you know, just especially now, and when you look at lockdown, I mean, it was, you know, and COVID times, music was the thing that kind of kept people going every single day. I don't think anybody didn't listen to music. So it brings people together, right? And so that was definitely something that Children's Music Therapy in England thought about. And they were also thinking, a music therapist can't run 10 music groups and then go to the hospital and then go and see a cancer patient and then go and see another client, you know. This is why they thought, how can we split this and look at which areas can be taken on by a qualified or experienced musician, or maybe experienced also in maybe the care settings or in special, you know, areas. Again, maybe people with dementia, maybe people who've had strokes, maybe children with autism, etc. So that is how we then, you know, looked at, okay, if we get experienced people on board that are musical and happy to help the community, then this is basically what we did. And we're covered. So how can you participate? You basically, we have a referral forms online. So people find us online or through social prescribing, and they'll find us, and then they can access these groups and say, I'm interested in the dementia choir, I'm interested in the aphasia choir for people who've had strokes, I'm interested in the learning disability choir, etc., etc. Which is actually not called like that, it's actually got a different name, but I just wanted to say the different things we offer. And then basically, yes, some of the choirs, I know we're running out of time, basically pay a weekly amount of money. There's no secret around it. For the dementia choir that I run, it's £5. The carers go free, and as many people can access this as possible. So sometimes I have 25 people in the group, sometimes I have 10, whatever. But people can just come whenever and pay, and that's it. And yeah, so that's kind of how it works. In some other places where I offer community music, there'll be invoices, and then it depends on what we offer. Yeah, does that answer your question?
Thank you so much, Eleanor, for your answer.
Thank
So we
you.
are approaching the end of this meeting, and I just want to highlight again that this recording will be posted in Facebook or in the European Music Therapy Confederation Facebook, and also I will put in the first comment the file with all the comments that we had during the session. So if you didn't have time to read this really rich amount of content, I will also post all the different topics that people discussed here, so you can have your time. And please, when we post this video, please use the space to continue with this discussion. So on the behalf of the Northern region of the European Music Therapy Confederation, so I'm closing this meeting. Thank you all and have a great evening. Bye-bye.
Oh, thank you so much.
Bye.
Thank you.
Bye. Thank you.
Thank you. Bye.
Bye.
Thank you.
Bye.